Leukemia is an illness that influences your blood and soft tissue at the center of the bones, which produces blood cells. It is not a very frequent cancer, but leukemia can be a very severe and serious condition. This disease can steer to the death, and dealing with your leukemia situation may be agonizing and challenging. Leukemia causes the excessive creation of blood cells. Regular blood cells have a restricted lifespan, and they need to be continuously changed by new, young cells to hold on their activity. There is a type of cell within the bone marrow, stem cell, that develops into the type of blood cells that the one needs. Usually, these stem cells separate either into white blood cells, red blood cells, or platelets, into a managed way. Leukemia perturbs the regular progress of blood cells and leads to the proliferation of partially developed cells that are not capable to fulfill their role inside the affected person. Assessing by the types of stem cells influenced by the disorder, leukemia can either be I. Lymphocytic lymphocytic A. Myelogenous lymphoma, lymphocytic. Lymphocytic leukemia is cancer of the blood influencing circulating lymphocyte cells. This particular is in distinction to lymphoma, in which a swelling of a piece of the human body, typically with no inflammation, triggered by an abnormal growing of tissue, regardless benign or cancerous, of the same kind of cells. Myelogenous lymphoma is a type of leukemia that happens when the white blood cells, which form a part of the immune system and assist guard the human body from illness and infection, divide faster than regular cells or stay longer than they are expected to. Lymphoma may grow in the lymph nodes, marrows, bone marrow, blood, or other organs, and ultimately they form a tumor. Assessing by the speed of growth and the perseverance of the disorder, there are two types of leukemia. I. Acute leukemia. A. Chronic leukemia. It all is based on the type of white cells that are impacted. The chronic one is called chronic lymphocytic leukemia, or CLL, chronic myeloid leukemia, CML. Leukemia, or even acute lymphoid leukemia, is an illness that advances very quickly. A couple of the signs and symptoms involve fever, losing the appetite, anemia, swollen lymph nodes, random bleeding, puffing, nervousness, sickness, pale gum line, moving arm or leg lameness, lack of synchronization, some microbe infections that appear because of the inadequate immune system. Most of these signs can cause death if the disease is not cared for. Acute leukemia deviates with chronic leukemia by the degrees which stem cells are able to get to in their growth. Stem cells that present exceptions still manage to partially develop and either resemble immature cells or flawless, regular white blood cells. Within the body of individuals who experience from acute leukemia of myelogenous, the bone marrow generates stem cells which form a type of partially full-grown white blood cell known as myeloblast. This kind of blood cell does not reach a complete maturity state and cannot deliver its projected role. Myelogenous cells tend to increase very fast and surpass the numbers of safe blood cells numbers, assisting the disease of anemia, infections, and deterioration of the immune system of the human body. The infected cells can also propagate to other places of the patient, such as the heart, kidney. As studies indicate, there are lots of yearly cases of the illness. Acute leukemia of myelogenous form becoming the most basic type of leukemia. Although the disease is recognized to regress quickly when the appropriate treatment is implemented, if left without treatment it may cause the dying of the affected person is sure. This kind of leukemia seems to regress to an earlier state, and it can redevelop with time. Within nearly all leukemia disorders, the first therapy stage is via induction chemotherapy. Chemotherapy, usually with high doses of anti-cancer drugs as cisplatin or methotrexate, in the initial treatment of cancers in order to make the following treatment, as surgery or radiotherapy, more effective. This specific leukemia radiation treatment has the function of getting leukemia into remission, which means abatement of symptoms of illnesses in effect to treatment. This entails that your blood numbers go back again to typical and the quantity of leukemia cells reduce substantially. This first leukemia medication cycle can be very intensive and it continues about 7 days. 3 weeks right after this radiation treatment, the sufferer must take specific medicines in order to heal. Some of the leukemia cancer patients can also be given extra treatment, depending on what sort of leukemia they experience from and how they have responded to therapy. The first time a leukemia-affected individual has this chemotherapy may not frequently turn out to be effective. The treatment may have to be recurring a couple of times over. Just after this induction chemotherapy, almost 80% of leukemia patients that are below 60 will be healed. The number falls at about 50% of all leukemia patients when it comes to persons above 60. If kids suffer from leukemia, next after this therapy is much more than 90% will be healed. To identify this disease, you will have to go through medical checks that generally analyze the bone marrow and do blood counts to see what the condition is. Also, a lymph node biopsy is carried out at the same time to see even if you have it in certain circumstances. The destruction to the organs is also decided from the blood assessments, and sometimes physicians will carry out X-rays and MRIs or additional kinds of screening tests. Typically, this is handled with medications that are merged with chemotherapy, radiation, and occasionally radiation therapy. Also, some people profit hugely from a bone marrow transplant, HSCT, too. It is essential to get the proper checks because left untreated, leukemia can be a deadly and fatal illness. But there are treatment choices and ways to defeat it.